There are studies linking stress to heart attacks, lack of sleep to heart attacks.
Is it true that Indians are experiencing heart attacks 10 years earlier than the West?
The burning issue now is young people having sudden deaths as well as having heart attacks at a young age who apparently seem fit and otherwise don't have any risk factors.
Somewhere do you think people are overdoing it in the gym?
The amount of exercise that you need to keep yourself fit is about 150 minutes of moderate intensity exercise a week. We have had people who take injectable hormones or tablets. We have had people who come to us having taken steroids. So the immediate effect is a rise of blood pressure and other things. But in the long term, it can also cause weakening of heart muscles.
We are also seeing a lot of very fit people, gym freaks,
Yes.
dropping dead and in the gym.
There are people, like you said, who are going to the gyms,
Yeah.
but otherwise sedentary. You know what happens then? So what you gain by going to the gym is almost partially negated when you sit down and have a sedentary lifestyle. Usually what we have seen in Indian population is that your good cholesterol starts to fall and bad is the one that keeps going up.
Okay.
So the bad cholesterol is the one that takes the cholesterol and puts it into the artery, and the good cholesterol one takes it from the artery and puts it back somewhere else.
Look at America, it's like the junk food capital of the
Correct.
world. But then how come their heart disease is less?
So firstly, the awareness there is much better. And secondly, like I said, see, genetically they are better off than what we are.
We live in a young country with over 65% of India's population being under 35. The Indian youth are becoming increasingly more fitness and body conscious, with new gyms, yoga studios and health food cafes springing up every day in our cities. One would expect this greater focus on healthy living and exercise to lead to fewer cardiac related complications. But on the contrary, we're seeing an alarming number of young, fit Indians succumbing to sudden heart attacks. Studies reveal that Indians are experiencing heart attacks 5 to 10 years earlier than other ethnic groups. So why are younger, fitter Indians more vulnerable to heart disease? Is it genetics or is it a combination of many factors? To shed some light on this issue, we have with us on Buzz by the Bay, interventional cardiologist from Jupiter Hospital in Thane, Dr. Gautam Rege. Welcome on the show, Dr. Rege.
Thank you for the kind introduction.
Yes, it's very timely because, we're seeing so many young people, in the public eye, also famous people who are very fit, suddenly succumbing to, to the public it seems it's a sudden heart attack. We don't know the underlying cause.
Correct.
Is it true that Indians are experiencing heart attacks 10 years earlier than the West?
That is correct. So essentially what is important to know is, as you have very rightly said, that the burning issue now is young people having sudden deaths as well as having heart attacks at a young age who apparently seem fit and otherwise don't have any risk factors. So what goes behind the scenes is what we should know about. There are many conspiracy theories floating around, but if you stick to science, then what we find is that it's a combination of multiple things. It's basically a lifestyle issue. So by lifestyle, it firstly begins with our sedentary life, So we are not walking around anymore. We are sitting in the couch and we are ordering stuff. So we are not walking around. Secondly, at times we are working from home. So we are not even stepping outside the house. So if you are sitting on a chair the whole day, you have a higher risk of diabetes, blood pressure, the so-called metabolic syndrome, right?
Yeah.
The second point is that many of us now have very bad food habits, right? So we have food fads where we have junk food, we don't eat healthy, we don't have someone at times who can make food at home, so we rely on outside food. we don't know what is being put in it. And all of this again causes a lot of increase in your bad cholesterol levels.
Yes.
Which can also further lead to blockages, right? And the third and final point in the lifestyle is stress and sleep. So in today's era, there is so much of stress that you're thinking about work all the time. There is competition all over, and it impacts your thinking, it impacts your sleep. So the recommended sleep duration is 7 to 9 hours. And if you ask me, and I can ask you, how many of us, do you have a sleep of 7 to 9 hours?
Not a peaceful sleep of 7 to 9 hours for sure.
Yeah. So majority do not get that sleep. So sleep is very underrated, right? So sleep is what, you can expend on it, and there are no consequences, apparent consequences. But there are studies linking stress to heart attacks, lack of sleep to heart attacks. And now you combine all the three, where you have a sedentary lifestyle, no exercise, you have a bad diet, and you have significant stress and lack of sleep, and it's like the perfect storm which is brewing there. And that is the reason why we are seeing a lot of diabetes, blood pressure in now these 20-30-year-olds.
Yeah.
And then this leads to blockages and attacks, and which is why we are having it much earlier as compared to our Western counterparts.
Yeah, I mean, amongst all ethnic groups, apparently we get at least on an average 5 to 10 years earlier.
Yes.
And the mortality rate is higher.
Yes.
Statistics show that the heart attacks were the underlying cause of up to 45% of deaths in the 40 to 69 year age group over here. And as of today, 1 in 5 heart attack patients are younger than 40 years of age. And Indians face 3 to 20 times higher risk of developing heart disease compared to other populations. I mean, these are statistics that are found from various articles and journals,
Yeah.
I mean, I don't know how accurate they are, but clearly what it points to is that we are at a greater risk and we are more vulnerable.
Correct.
And you've said these factors, but now I just want to clarify. So you said sedentary lifestyle.
Yes.
But people are more fitness conscious. That is a fact. We have more gyms. We have more young people working out at gyms.
Yes.
So, I mean, so what you're saying is that our overall in our daily life, in our home or work life, we don't get up and move around as much. Is that what you're saying?
So, two questions there. One was the genetic risk.
Yeah.
So, I'll get to that first. So, our population, that is we South Asians, so we have the highest risk of having coronary artery disease, that is blockages, as compared to everyone else on the planet. And the reason is that we tend to be more diabetic as compared to the rest. We tend to have more of bad cholesterol as compared to the rest. We tend to be relatively more inactive because the European life, they have more of cycles, they can cycle to work, something like that. And the fourth point is that in all of this, we have lot of stress, right? And stress, junk eat, and truncal obesity, what we call visceral fat.
Visceral fat. Yeah.
Correct? So this combines to have a higher incidence as well as an earlier incidence, right?
Okay.
So like you said, 10 years earlier, higher as compared to the rest. And I will not say that there is a lack of facility, but then the facility is not exactly being availed by people.
What facility? Like the
healthcare facility.
Okay.
Because if you have pain, most of the times it is ignored. Someone might think it is this acidity. I'm a young person. Why should I have it?
Yeah.
And then they can just pop some antacid pill, see if it is going away. It is not going away. Then they come to us, say after a day or two later, that it's not going away. What do I do now? So in a patient who has a heart attack, every minute matters. So we have a rule called the golden hour rule. So for example, it's 1:30 now, right? So if I'm having pain now and an attack now, if I get myself treated by 2:30, that's in the next 1 hour. So I go to the hospital, everything happens immediately. So the risk of death is the least. The risk of permanent damage is likely negligible.
Okay.
So you can imagine 1 hour, right? Subsequently, every minute matters. So you have some benefit up to 12 hours and practically 24 hours there's no benefit. So someone who has ignored his symptoms maybe just taken some over-the-counter pill and has come a day or two later, he has already missed the bus.
Missed the bus. Oh gosh.
Yeah. So at that point, if an angiography is done or an angioplasty is done, and the area of tissue that got damaged is damaged forever, then you just can't get it back.
Okay, so you should go by within the hour actually, typically.
Correct. So if someone has pain, no one can say looking at someone that this pain not related to heart, because a pain need not always be in the chest or it need not go to the hand. People wait for typical symptoms that my pain was not here, it was on this side or it was to the jaw. Yeah, so many times you have patients, so the typical chest pain is pain just behind here, which can feel like someone is putting like a heavy stone on you. It's a compressive thing. It can go to the left hand, it can go to the right hand, it can go to the jaws. Usually it is increased by walking. So this is the typical description. But we have 30% patients who have no chest pain.
No chest
No
pain.
chest pain
Then
whatsoever.
what symptom do they have?
So they have either breathlessness, they have fatigue. In elderly, they can just fall down.
Just fall down.
Yeah. So these three. Now the issue is that when someone does not have pain and his ECG, for example, clearly shows that there is a heart attack, we have a difficult time, telling them now the next treatment is angioplasty or angiography, because they say we have no pain. So once we show them the statistics, 30% have no pain, and all your tests are clearly negative, so that is when things move ahead. But this is an important conception, an important awareness to know that pain is not always here and here. Pain can be upper side and can go anywhere. 30% just may not have pain. So the only way to know is test.
But if you don't have any symptoms, then you won't go for a test and then you may just collapse.
Correct.
Then that's just bad luck. No, what can you do then?
Correct. So that's a good point. Now the unfortunate portion is that around 10 to 20% who have never had a heart related issue can just collapse there, right? So that is the first sign that they know that something happened. Then there is either some well-wisher or some family member who gets them to the hospital, and then they are treated then, right? So lesson to be learned here are two. One is that if someone like this in and around you is having such a symptom and has collapsed, we as a country need to have a very extensive CPR training. Do you know about this concept? So if someone has fallen down, has no pulse and is not breathing, so you press on the chest, you start breathing so that oxygen goes in, because many a times the only thing that happens is that they are given some water which is not really beneficial, then they are taken to the hospital. So if say half an hour has gone by, so the brain has not received any blood or oxygen for half an hour, so that again creates permanent damage.
Yeah, then they're brain dead, right?
Exactly. So that's the first point, that if someone has collapsed, like you said, then we need to start this CPR awareness. So someone who is CPR trained in your facility can be immediately summoned, and that can be done first. The second is, like you said, what if someone has no symptoms? Okay, so that is where your preventive health clinics actually come into picture.
Yeah.
Right? So why is this important? Because in our mindset, अगर मुझे कुछ तकलीफ ही नहीं है तो मैं क्यों जाऊँ किसी के पास? It's a very common and it's a logical thing actually if you go to see that if I don't have any issue, I should go to someone.
नहीं है तो मैं क्यों जाऊँ? पैसा क्यों खर्च करूँ? Why should I take the trouble also?
Exactly. So the answer to that is that many of these, for example, BP, sugar, they are silent diseases. So you need not always have a pain or a headache or something like that to suggest कि ये है. You need to test yourself. For example, if someone has a blockage and is just sitting peacefully here and has a 70% block, he will not know that he has a block unless it is tested. Not all patients have symptoms, that is what we discussed. So that is where preventive health checkups are coming in, where we test these individuals who have absolutely no symptoms and try to detect diseases that are silent, and then we can treat them before they have an issue in the first place.
Very important, that preventive bit, and actually I want to get to that in detail towards the end of the interview as to what tests they should do.
Sure.
The blood test as well as the CT angio and other tests that one can do. We'll get to that in detail, but it's a very, very important point, because sometimes these are silent, there are no symptoms and someone can just collapse, and then it's too late. So I think if someone is genetically predisposed, like if in your family there's a history of heart disease,
yes,
I think what you're saying is you should whether you have symptoms or not, whether you're slim or fat or not, you should just go and have your regular tests done.
Correct.
You know, to rule out those blockages.
Yes. So if I can rephrase your question, you know, who should have a health checkup is what you're saying, you know, before you actually collapse and something like that happens. So typically it is people who are diabetic, hypertensive, obese, or already have been detected with a high cholesterol level. Like you said, family history of there either being a sudden death or there being a heart attack in the family, especially at a younger age. Right? So these people definitely need to get themselves tested before they have symptoms, so that there is no lasting damage that occurs.
I think that's very important for people to know. Satark rehna chahiye. That is absolutely important. So coming back again to causes and genetics, well, a few things you said earlier. So you said the sedentary lifestyle here. But at the same time, we are also seeing a lot of very fit people, you know, gym freaks dropping dead and in the gym.
There are people, like you said, who are going to the gyms, but otherwise sedentary. You know what happens then?
No.
So what you gain by going to the gym is almost partially negated when you sit down and have a sedentary lifestyle. So if you have gained 100%, you have lost 20-30% just by sitting around.
How interesting.
So so you need a regular fitness routine where you're active in the morning or in the evening, whenever you're doing your gym or yoga or walking, whatever it is that you're doing. But you also need to be active in the day, right? So that bit is also important. People think that if I have exercise in the morning, I can just, you know, laze around the whole day. But that's not true. So now they say, I am sure you're aware, that sitting is the new smoking.
I was just going to say that.
And we are sitting here. But
we are sitting here, but you know, you're otherwise active. I am also running up and down the office, but
Exactly. So people recommend standing desks now. People recommend, you know, walking up the stairs, not taking the lift. So these are things. So you want to avoid a prolonged sitting. Okay. That is what you want to avoid, and you want to be active at work as well as active at exercise. You know, both is important.
Okay.
Now the second question that you had asked was that, you know, these apparently fit people are also having, you know, these heart issues and they're dying suddenly. You know, what is happening there? So, you know, not all sudden deaths are related to the heart. And not all heart related deaths are heart attacks. Okay. So typically in the younger population, say who are in their 20s or 30s, okay, we have people who have other issues of the heart. So what am I talking about? So typically we have athletes who have thickening of the muscle of the heart, is what we call hypertrophic cardiomyopathy. So these people is typically seen in athletes, even professional ones. So where they do a heavy workout, and then there is a suddenly fast heart rate that comes from the lower chamber of the heart and they just collapse there. So there is a huge debate that is going on about screening the athletes before they actually go in for a marathon or not. It's happening worldwide. So that is one point. The second point is there are other genetic factors, like someone who has an arrhythmia, it's a genetic thing.
Irregular heartbeat.
Exactly. So irregular or slow heartbeat, or a type of heartbeat that can suddenly accelerate with exercise. Third is you have people who have a congenital heart disease. So these are people who have had a sort of complicated hole in heart in their childhood but not never detected. Okay. And the last point is something we call as commotio cordis, where, you know, if there's sudden blow to the chest, you know, that can also cause a person to collapse. You know, now these people typically do not have a chest pain because they don't have blockages, right? So they can just have fainting, they can just have breathlessness, which is then swept under the carpet. We have two extremes, either people on the couch or people want to do the entire 42, you know, marathon, which is not right, you know, because you have to warm up your body. If your body is not conditioned, again there is dehydration, people fall down there in marathons and it's not a good scene. So you need a graded warm up exercise, a graded cool down, which is equally important.
So coming to some of the cases we've seen recently, again, you know, amongst the males we saw, very sadly in the last few years, we saw young fit people. We saw Puneet Rajkumar, we saw Siddharth Shukla, who was only 40. We saw Siddhant Suryavanshi, who died during a routine workout in Mumbai in 2024. Somewhere do you think people are overdoing it in the gym?
So, firstly, it's a controversial topic to get into because there's not a lot of literature there. But if we have to take it from a strictly medical perspective, so the amount of exercise that you need to keep yourself fit is about 150 minutes of moderate intensity exercise a week, right?
150 a week.
150 a week, and 75 minutes of high intensity a week, right? This is what we need to be fit. Now what we have seen is someone who doesn't exercise, say, has a risk of a heart related issue which starts to drop whenever they start to exercise, and it's at the bottom when they are doing this level of exercise. But if they are doing it at a much more intense activity, especially marathons, then probably some hemodynamics change and there is a slight uptick there as compared to people who are doing those, say, 30 minutes a day or so. Reasons are not known, okay? But what we suggest people typically in their 40s and 50s is that the aim of fitness here is to be fit and to keep your body fit. So we usually advise an exercise that is moderated, okay? And like I said, for someone who is passionate about it and wants to go for it, if he's been screened well and he's doing a graded warm up and cool down, then I don't see any reason why they cannot do it.
Okay, you don't see any reason.
Yeah.
Again, the other controversial issue is protein supplements, steroid injections, anabolic steroids, other substances. Can they have a negative impact on heart health?
Correct. So, it's again a fad in today's era that people want pretty quick results, whether it is the gym or it's the cosmetic industry, right? So in the gym we have had people who take injectable hormones or tablets. We have had people who come to us having taken steroids. So the immediate effect is a rise of blood pressure and other things, but in the long term it can also cause weakening of heart muscles, blockages, all these issues which happen few years down the line. So people stop attributing that to this, but that is one of the reasons. The second is that the anti-aging stuff, right?
Yes, I wanted to come to that because we had this tragic demise of Chef Ali Zariwala, again at the age of 42.
Correct.
Very untimely, very fit, very slim. But there's all sorts of speculation. I don't want to speculate on her case, but in general I wanted to ask about can anti-aging medicines and can glutathione drips and things like that trigger?
Correct. So what is important is we need to be more natural as much as we can, and all of this stuff tends to be unnatural, right? It's not suited to the body. So all of this anti-aging stuff is not recognized by any of the commercial markets, right? It's not recommended by the FDA.
I thought many of them are FDA approved.
Correct. So yeah. The ones that are usually not injectables. So yeah. So and in addition to that, many of these tend to be self-administered. So the dose may be wrong, the way it is given may be wrong, and in the end what you have is that many of these medicines like glutathione and vitamin C injectables, so they itself cause some dehydration and low BP. So if someone is, say, already fasting and on top of that is some injectable thing goes in, the BP falls even lower, and that can be life threatening.
So you're saying be as natural as possible. There's definitely a risk with stuff like glutathione drips and things like
yes.
that. What about like glutathione oral capsules and all? Those may be safer, you're saying, if someone wanted to take?
Correct. So I would say that if you have been prescribed this, then you can take it in the prescribed dosage.
Okay.
So unprescribed dosage and self-administered, definite no.
And especially injecting yourself is not advisable at all.
Yeah.
Right?
Yes.
I mean, so these can have an impact, you're saying.
So this is, you can say at times spiritual discussion of, where are we going with this, and what kind of a person we want to be, to avoid, getting into these kind of medications where you want to look younger and you want to, have a short path to success.
Yeah, that's a whole other spiritual discussion on
Yeah.
karma and acceptance
Exactly,
and
yeah.
dharma and all that sort of stuff.
Yeah.
Interesting, because at the end of the day, it all ties up, with
Exactly.
one another. It's all to do with your well-being.
As far as remaining fit is considered, none of these things are recommended. No steroids, no vitamin C and no glutathione, nothing of that sort. What you need is a healthy diet. You need to be fit and you need to sleep well, right? So it's pretty straightforward. It's not expensive, but that is what we want. We don't want the run-of-the-mill stuff. We want to buy something, give it to ourselves, and want to get better because we bought it and gave it to ourselves, right? Because it's the easy thing to do, and unfortunately, it's not the right thing to do. So we really need to wake up, and like you said, there are so many people who are dying young, and we just have one life. Again, a spiritual discussion.
That's another spiritual discussion.
Yeah.
One life in this form, at least.
Exactly.
Yeah. Okay.
So we should really try to be healthy and try to encourage others to be healthy.
Yeah, because actually you can do anti-aging exercises with yoga. You can
Yes.
achieve a lot of the things with yoga.
Yeah.
And you're saying, a lot of these things aren't even approved, so you really have to be careful. But then that's also a multi-billion-dollar industry.
Exactly,
So
yeah.
what are you going to do about it,
Yeah.
right? Coming to so your patients, your Jupiter Hospital, are your patients? I mean, do you see now a rising number of young people coming to you, and when they have this weakened heart because of steroids and things, what do you advise them? Do many of them have to do stenting and things like that?
Correct. So as compared to the previous decade, we do have people who are younger coming in with heart attacks, and reasons, as we discussed, are because of lifestyle and stuff, but we definitely have younger people coming in. Unfortunately, the younger people don't tend to do, like I said, as well. They have a slightly higher risk as compared to the older population.
Why is that?
Correct. So it's because one is not detected in time, and secondly, that they tend to have these other risk factors which are not treated. So for example, someone who is an elderly, say 60-year-old, and is diabetic, so he is already been taking medicines for diabetes, is well controlled, and now he has a heart issue. On the other hand, we typically have a 30-40-year-old who has come in with a heart attack, and turns out that he has had diabetes for a long time, or has had blood pressure for a long time, everything is uncontrolled. So that is an important issue, that younger people coming in who are not screened prior, as well as who are ignoring the symptoms and coming in late, which is why there is this higher risk.
Okay, higher risk because they're not screened prior or coming in late. Like you said, an older person will already be on certain medication.
Correct.
And that will give them some degree of protection.
That is correct.
Okay, that's interesting, and that's something that people should know.
Yeah.
Coming to what you had mentioned earlier, there's of course genetics. You said South Asians are more prone to heart disease, but let's talk about epigenetics.
Yes.
In this whole thing. We know that genetically we're prone, but there's epigenetics, which is the layer above, it's the environment, or the layer above the genetics, which influences your gene expression.
Yes.
How important is that in the whole scheme? You already mentioned a lot of it with diet and, but what about things like pollution and all that?
So genetic makeup is something that we cannot change. So we have to accept with the genes that I can say we are given.
Yeah.
On the other hand, the epigenetic factors are extremely important, because it's not only the genes that cause this issue, it's a mixture of both, and both are equally important, especially if there is a non-modifiable factor. We cannot modify genes, but we can definitely modify the environment we live in. So people who either smoke or have passive smoking, where there's tobacco intake, where all these other risk factors are present. So these factors combine with the genetic factors to cause a much higher risk. So without getting too jargony about it, if I have to say that if I have a gene, okay, and the way it is going to present itself depends on these factors. So this is what we call as a second hit hypothesis, that you already have a risk factor in terms of the gene, but if you also have smoking, or if you also have diabetes, then it hits on the gene and you have a higher risk factor. On the other hand, if you still have the gene and you're not doing these things, then the gene will present in a different form, and your risk is lower.
Let's go to this metabolic syndrome, which is a cluster of 5 risk factors. I was looking at it on the Jupiter, Jupiter Hospital page, in fact. If you could explain what is metabolic syndrome, how to identify it, and why is it related to heart disease?
Correct.
Yeah.
So by metabolic syndrome, when we say metabolic syndrome, it's usually a cluster of someone who's obese, someone who has blood pressure, someone who's diabetic, and someone who has a high cholesterol level. Now, unfortunately, all these illnesses tend to be synergistic. So what do I mean by that? So someone who is obese is likely to be diabetic, someone who is obese is likely to be hypertensive. So even if you're not hypertensive to begin with and obese, you have a higher risk of being hypertensive. So on the other hand, if you reduce your weight, then you have a lower risk of again becoming hypertensive, lower risk of becoming diabetic. So our population, many people are now starting to develop metabolic syndrome, where we see these patients coming into us during their health checkups, where they are slightly overweight, their cholesterol levels are slightly going up, their sugars are slightly going up, so commonly known as pre-diabetic, and there are people whose BP is slightly going up. So this is the point where they can really modify it, because what happens is that if they just say, what the hell, I'll just enjoy my life for the next 5 years or so, when they come back up again, they have already developed metabolic syndrome. So they have developed diabetes, they have developed blood pressure, and they have developed obesity and everything. At that point, we need to give them medications, and that is when they ask us, can we do something without medicine? So the chance was 5 years back.
When you could do like functional medicine,
exactly,
like a combination.
Yeah. So that is the whole point of the health checkup, that if you have detected that if you don't control your lifestyle, you can develop these issues. Patient who has blood pressure tends to have, say, this risk, just diabetes this risk, but diabetes and blood pressure, it's high, right? Yeah. So they tend to have the bad cholesterol, that is the one that goes and sits in the artery of the heart, causes narrowing and blockage and more attacks.
Yeah.
So if we have to reverse the number of heart attacks, we need to target the metabolic thing, where we need to target getting your BP down, getting your sugar down, getting your cholesterol down, and leading an overall healthy lifestyle.
So they call metabolic syndrome because they affect the body's metabolism. Is that how?
So it's the way you metabolize things.
Is the way you metabolize.
Yes.
Things. Okay.
So, and like I said, it's linked to one another.
Yeah.
And if it is linked to other, these diseases are also called inflammatory disease, because there is some amount of inflammation that is occurring, and any inflammation in this subset is not a good scenario to have.
So this metabolic syndrome, also one of the signs is increased waist circumference.
Yes.
So how much, like what should it be? What should a normal waist circumference be?
Correct. So usually rather than looking at the waist circumference, we try to measure the waist to hip ratio, because that is what tends to get affected, and we want to measure the BMI. So normally, which is a ratio of the height and weight, right? So we want the BMI to be between, say, 18 to 24. Anything more than 24 is high. So more than 30 is obesity.
Right.
So you want to keep your BMI in that range, rather than having just a fixed circumference.
Okay. And also high triglycerides is another indicator, right, of metabolic.
Correct.
Yeah.
So Indian patients tend to have a higher triglyceride as compared to the Western counterparts. Similarly, we tend to have a higher LDL as compared to a Western counterparts.
LDL is the bad cholesterol.
The bad cholesterol, yes.
Okay.
So which is why we tend to have a higher and earlier, chance of having heart blockages.
But a lot of doctors now are saying that it's triglycerides that matter more and not so much your cholesterol. What's your view on that?
So strictly speaking, from the heart point of view, unless the triglyceride level is very high, we are more concerned with the LDL cholesterol rather than triglyceride itself. The triglycerides can cause other issues in the body, but mainly for the heart, it is the LDL that matters.
Mainly for the heart, the LDL.
Correct.
What if your good cholesterol is also very high?
So usually what we have seen in Indian population is that your good cholesterol starts to fall and bad is the one that keeps going up.
Okay.
So the bad cholesterol is the one that takes the cholesterol and puts it into the artery, and the good cholesterol is the one that takes it from the artery and puts it back somewhere else. So that is why we want to have a higher good cholesterol and a lower bad cholesterol. But unfortunately, reverse happens. So the way to have a higher good cholesterol is to exercise again,
Okay.
to have more of good food. So you want to have more of, say, the low fat high fiber diet, which is in vogue nowadays.
Yeah.
And if you want to have fats, to have the sort of unsaturated fats, again a fad nowadays. So these help to get the good cholesterol up.
And not the trans fats.
Exactly, not the trans fats. You should
Okay.
avoid the trans fats.
Okay, which are like trans fats, if you can give a couple of examples.
So mainly we want to avoid the saturated and the trans. So typically it involves butter, it involves lard, it involves ghee to some extent. So these are the items you would want to avoid. The trans ones especially are there in lot of junk foods, like your burgers and like some baked items.
Okay.
So the key message, it's not jargony. You can just say that have healthy and natural food, and none of this, your burgers, your pastas and your pizzas do not exactly fall in our Indian diet.
No, they're not. But that's the thing. Actually, I mean, yes, people say there's more, maybe now there's more junk food and all available in India.
Yes.
But if you see around you, doctor, there's also a lot of healthy restaurants popping up.
Yes.
Very expensive ones that too. And I'm
Yes,
just
yes,
saying that,
yes.
and they give you things that you can, like millets and all, which
Yeah,
you can
yeah,
easily even
yeah.
make at home.
Yeah.
And look at America. It's like the junk food capital of the
Correct.
world. But then how come their heart disease is less?
So firstly, the awareness there is much better. And secondly, like I said, see, genetically they are better off than what we are. So we really can't compete there. What we can do is that try to be as healthy as possible. Like you said, epigenetic factors are working
Yeah.
here. So we have healthy options now. So if you try to stick to the normal food that you have every day, fresh fruits, vegetables, salads, that is the best thing that you can have. And if you want to have the healthy option, commercial option, that is also fine. But the point is you want to avoid the unhealthy stuff, or at least try to limit it. Because you don't see, it doesn't happen that you have a burger and you have a heart attack right there.
Yeah, obviously.
Yeah, so it's that, it's going to take a longer time, and that's why we tend to underestimate the choices that we make. That we'll keep eating and then, nothing usually happens and then keep doing it.
Yeah, but because our simple ghar ka khana is actually
Yes.
pretty good, right? Even dal, rice, sabzi is
It
all
is.
right. It's a balanced diet.
It's a perfectly balanced diet.
Yeah.
So, that's the whole, you can say, the circle where we began with a relatively balanced diet, and then we went to the junk thing, and now we have cereals that are American brands and stuff like that.
Yeah, yeah.
And now again we are trying to come back to the
Millets and
regular,
things like
the
that.
healthy stuff. So once we go back to it and try to lead a healthier life, we will reverse this.
Okay, what about alcohol? Absolutely no, or in...
Correct. So again, it's a controversial topic. So there are two things here. So one is that there is a new study by the Americans which suggests that any amount of alcohol has a higher risk, especially of cancer. So it's now coming in the way of cigarettes. So cigarettes began like this, that in the early 70s,
Yeah.
the first risk factors had to come in, that cigarettes can be linked to cancer.
Yes,
So
yes.
same thing happening in alcohol now.
Yeah.
So any amount of alcohol is said to be harmful to the body. From the heart point, strictly speaking, a glass of wine or something is said to be fairly okay.
Is it?
But unfortunately, in our scenario, people cannot draw a line, so it's just best to avoid.
Best to avoid.
Correct.
Okay, and smoking totally.
Smoking
right?
totally.
Yeah. And of course, substances, people say like, I mean, any sort of substances are bad. Narcotics.
Yeah, so it doesn't take a lot to figure out that any added substance is not good for your body. It's not good for the heart. These added substances cause rise in blood pressure. They cause narrowing of the arteries, what we call vasospasm. So they can cause sudden narrowing, sudden
Yeah.
pain. So we would want to avoid them, whether they're inhaled or injected or swallowed.
What about even people do recreational drugs which are legal in some countries like marijuana and stuff? Are
Correct.
those also harmful for the
So
heart?
medical marijuana is a different thing, and again, like I said, it's controversial, into which I would not like to enter.
Okay.
But the point is that there is no benefit, right? So why
But
do it?
people tend to say there is a benefit. I don't know. They say it relaxes the mind. I don't know.
Correct. So we have yoga and meditation.
Yeah.
You don't have to inhale something to relax your mind,
Yeah.
because that is where we are going wrong, as a community. That if we need a substance to relax our mind, if we can just sit in this very chair and close your eyes and focus on your breathing, just breathe in, breathe out, breathe in, breathe out. If your mind gets diverted, focus it back on the breathing. Just do it for 5 minutes. It doesn't cost you, it doesn't take anything, and it will give you peace of mind, which you want from the substance, right?
Absolutely.
We have had patients where getting the stress down itself has caused their BP to come down without need of medication. So what more would you want? People are hesitant to go to a psychiatrist if there is stress, because it's a taboo in our society, that मैं पागल नहीं हूँ, मैं क्यों जाऊँ psychiatrist के पास. It's a very common thing. But given our lifestyle and our stress, if a psychiatrist opinion is needed or counseling is needed, we definitely should go for it.
Absolutely. I agree with you. Mental health matters.
Yeah.
And this is what our yoga said thousands of years ago, that
Exactly.
most diseases originate in the mind.
Yeah.
They're mostly psychosomatic and then get transferred as diseases to the body. Lastly, I want to ask you one question before we go on to quickly just the tests one should do.
Yeah.
What's the link between COVID, the infection, and the risk of developing heart condition? Because according to a 2022 study, of even a full year after COVID-19 infection, the risk of developing a heart condition such as irregular heartbeat, heart failure, inflammation or heart attack was substantial. What's your view on this? Have you seen this happen?
We have seen this happening. So again, there are two subsets here. One is that who had a heart rate issue when they had the COVID. So COVID was a novel disease. We had never seen it before. So every day is learning new stuff about the virus. So there were definitely a higher incidence of heart attacks during the inflammatory phase, that is when people had it. But now, like you said, 1 year, we have data of 3 years. Like people who got infected in the first wave, they still tend to have a higher risk factor as compared to people who did not have it. So the reason behind that is that this virus, for some reason, it loves the vascular tree. By vascular tree, I mean the arteries and veins. So it tends to stick in those arteries, and then one day it can just cause it to kind of rupture or erode there.
Oh my God, like even much later.
Much later.
That's
So
scary.
that is. So we don't know the reason behind it, but like we discussed that it's not the only reason. We have had these other risk factors like diabetics, hypertensives who also had this, and then they tend to have a higher incidence of there being heart rate issues. So to just summarize it, yes, there is definitely a higher incidence of heart related issues post COVID, especially in the younger population. However, it's linked to the virus and not to the vaccine.
Okay, last section. What tests are recommended, and what, I know we covered a bit of it in the course of the interview, but if we could sum up, at what age should people start doing tests to diagnose blockages? If they're doing a blood test, what parameters should they look for metabolic syndrome, and inflammation and things like that? So if you could just give
Correct.
us.
So mainly the age group is 30 plus, that now you need to start screening yourself, especially if you have these risk factors of family history of heart disease and blood pressure, diabetes, cholesterol, obesity, smoking. That being said, most of the health packages tend to have all of this in one go. So you don't have to really pick and choose, what you have to do. But we should also know, what is the point of doing a test and what does it convey. So what I mean by that is, typically a health checkup for the heart will have an ECG. So it may have a 2D echo, it may have a stress test. Okay. So the ECG tells us about the electrical functioning of the heart. It may tell us about, like I said, these arrhythmias, which are heart rate issues. It may tell us about past heart attacks, but it will not tell us if there is a block, sitting there. Same or similar goes for a 2D echo. It can tell us much more in detail about the structure and function of the heart muscle, whether there was a heart attack in the past, but again it does not detect blockages. Thirdly, like we said, the stress test. So these stress tests where you have to usually walk on a treadmill, and then there are ECG leads connected to you, and we look for the changes in the ECG when you actually do the treadmill. If there are particular type of changes, we say that yes, this test is positive, though there is a likelihood that you have blockages. So among these three tests that we discussed, the ECG and 2D echo, the test that can relatively detect blocks is the TMT, that is the stress test.
Okay.
But again, is it foolproof? The answer is no. So blocks that are less than 70 may not get detected by the stress test.
Less than 70 won't get.
Exactly.
Okay.
So there are tests where we call that is false positive, where there are no blocks but the test has come positive. This happens. Secondly, there are tests where there is a block and the test comes negative. That's a false negative. Right?
That's scary. Yeah.
Yes. So do you need to test yourself further? So the best thing would be, once you've done a health checkup, if you can meet your local doctor and see him, and he can guide you whether you need to test yourself further to see if there are actually blocks sitting there or not. Now these are imaging tests. What about blood tests? So in addition to the cholesterol, there is a test called lipoprotein A, which especially is important in people who have a family history of heart disease. And lastly, we have a test called high sensitive C-reactive protein, CRP. So it's a marker of inflammation. So these are the tests that are usually there in all the health checkup packages related to the heart.
Triglycerides also.
Yes.
Yeah.
So the lipid profile will have triglycerides, LDL, HDL, so good, bad cholesterol, everything in it.
Yeah.
The way to interpret it, if all the reports are okay, is that currently you're okay. It does not mean that you'll be okay for the next 2-3 years, right? For that, you have to keep working so that you stay healthy and fit. It tells you about the situation right now, okay? It does not give you a license to, just do whatever you want for the next 10 years or so.
Yeah. And how often should you have these blood tests?
So normally we suggest certain tests like cholesterol and sugars every year or so, because the moment they start to go up is when you would want to have medication. You don't want to miss the bus that they have already been there for some time. So health checkup packages usually tend to be yearly.
What about tests like CT angio to detect blockages?
So conventionally we don't recommend CT angios to everyone. So like I said that if you have been checked by your local doctor and he suggests or he feels that there is a need for CT angio, then that can be done. So there are two parts in the CT angio. One is something called as the CT coronary calcium score, which is an indirect measure of blockages, and then the CT angio in itself, which is like a non-invasive angiography, and you see the blocks though they are even 10 and 20%. So not recommended for everyone, recommended after you have been advised by your local practitioner.
And if you have a family history maybe, or if you're above 40 or...
So again, that's the whole point, that why we do not suggest this directly to lay population is that any test has its associated risks and benefits. So CT also is a ionizing thing, it gives a radiation, right?
Yeah.
So how, if you keep doing CTs frequently, your radiation exposure goes higher or cancer risk goes higher.
Oh gosh.
So you should do it at the right time, at the right place.
Okay, but typically this lipid profile, the blood test and your 2D echo and other things should suffice.
Correct.
Okay, regularly, and start at the age of 30.
Yes.
And then at least once a year you should go ahead and...
So once or twice a year depending on the risk profile.
And if we follow all these instructions, people should be quite safe then?
Yeah, people should be and people are. So, this is what happened in the US. Pre-COVID, there is data that, the incidence of heart disease is going high and there's awareness, and then it started to come down. And now there's an uptick post-COVID again. But then it did come down, and that is what we expect will happen here. Once there is more awareness and people start to follow, the incidence of heart disease is going to come down.
Okay, let's hope for that. Thank you so much, Dr. Gautam Rege. Thank you so much for coming on Buzz by the Bay. Extremely important information. Very, very useful and very helpful. Thank you so much.
Thank you.